So, thank you for the introduction. I hope that you can see my slides now. And what I will talk about is something that's called Chronorobotics and the use of its temporal models for crowd forecasting to aid social distancing. So actually, let me make a brief introduction of myself. Wait a minute. Are the slides still visible?
No.
Sorry. Okay. For some reason,
No,
I cannot
it's
put
okay.
them into presentation view, but yeah, we will have to live with this. So, as I said, I do research in mobile robotics, and I am a member of a Center of Robotics and Autonomous Systems at the Czech Technical University. And my recent projects, they involve mobile robots or teams of mobile robots. So if you are into drones or flying robots, you might have heard about the Mohammed bin Zayed robotics contests, where drones and ground robots were supposed to do autonomous construction of walls and firefighting and drone capture, etc. And this is something we have been participating during the last years. And also some of my work includes search and rescue operations. These are now financed by the Defense Advanced Research Projects Agency by the US. And in there, what we are doing is that we have teams of mobile robots that are operating in mines, and they are performing basically search and rescue. However, the project that I'm most proud of is a project that we have been working during 2013 to 2017. This project was called Strands. And in this project, we had a robot running in a hospital, and the robot had to run there fully autonomously for 4 months with no expert intervention. So we really had to put the robot there. The robot had to do a couple of tasks, and it had to run there by itself for more than 4 months, without us intervening. So one of the biggest problems that robots have indoors, apart obviously for stairs, is the fact that the environment is changing over time. So if you want to deploy a robot in a new environment somewhere, what you typically do first is that you create something that's called a map. So you place the robot there, you drive with the robot around, and you use the data from its sensors to create a fine detailed map that the robot later can use to determine where it is, and it can also use this map for planning. So this problem is typically called in robotics simultaneous localization and mapping, and this was a focus of research for quite a lot of years. And so we have now in robotics, you are able to create really large maps, several square kilometers big, and with very nice granularity, let's say millimeter or centimeter level. One of the problems, however, that was a bit unexplored, and that's very, very important to tackle in robotics, is the fact that any map becomes obsolete after some time. So for example, if you see this example of a map, which is a park, only after a few hours, the map looks like this. And this is something that you need to tackle because either all your mapping effort became useless after a few hours, or you have to create another map and another map, and you have to perform the mapping again and again and again. And that basically means that you are losing efficiency of the robot deployment because creating maps is not what you want the robot to do. So what we were trying to tackle is the fact that the environment doesn't change for no reason. There are some processes that actually introduce the changes of the environment, and many of these processes, especially indoors, they are caused by humans, by the people that move around. They shuffle the furniture, They close and open doors, they switch on and they switch off lights, etc., etc. So what we have been trying to tackle are these changes that are either caused by humans or changes that are, let's say, natural because of the day-night cycle or because of the seasonal cycles. Okay, so in robotics, most of the spatial models that are used nowadays, they are composed of independent components, and these components typically attain binary states. So, for example, you can have a representation of the environment that shows you where there are obstacles in 3D and which places are actually empty. And this works in a way that you chop the environment to small pieces, to a 3D grid, and you tick those cells that are occupied and those cells that are not occupied. If you want to have another representation, you can have a topological map where you can see which edges in your topological map are, let's say, traversable or which are being blocked. Or on a symbolic level, you can model if the doors are being open or closed, or you can model if a landmark is visible or not. And one of the problems is that you are never certain about any of these states because you are perceiving the environment through sensors, and these sensors are typically noisy, and perhaps the environment is adverse and you cannot really sense the state correctly. So you have to somehow represent the uncertainty of each individual state in your model. And so far in robotics, the paradigm of sensing was based on the fact that the uncertainty is represented by a probability, and this probability is a constant. And you updated this constant only if you are aiming your sensors, your cameras, your radars, or whatever, at the particular area of the environment which you are actually sensing. So the problem is that the representation or the mathematical foundation of these models actually says that the environment is stationary. And this imposes strong limitations on long-term operations of the robot. So, as I previously mentioned, what we have been trying to research is to use alternative representations of the probability. And the core idea is that we want to represent the probability as a function of time. And one of the first things that we tried is to basically say, okay, let's represent the uncertainty as a combination of harmonic states. So the idea is that you would say, okay, there are some processes that influence these probabilities, and the influence and periodicity can be extracted from the data themselves, and then you can use this function of time to actually make a forecast of how the environment will look like at a particular time, and you can use this for the advantage of the mobile robot operation. So let me show you a video example, if I manage to do that. So imagine that you have, again, a very simplistic map of an office. In this office, you have a few areas, and you know how these areas look like because the robot took pictures of these before. And now a robot is placed somewhere, it takes a picture of the environment, and it has to find out where it is. So this is an easy task nowadays, but the problem again becomes because of the environment changes. So how we actually tackle this is that, as I said, the changes exhibit certain patterns. So you can see the appearance does not change completely and randomly, but there is a certain pattern to the appearance. So what we basically did in our early approaches is that we took certain features that we can see in the environment. We used the data that the robot gathered over time, and this formed a binary function of time, for example, of this one particular white feature that we see there on the glass. And we extract something that's called a frequency spectrum of that. Then we take the most prominent spectral components of this frequency spectrum, and we transfer it back to the time domain. And what we get is a probabilistic function of time that allows us to reconstruct the past the history of this feature being visible. And also it allows us to predict the probability of the feature being visible in the future. So to actually validate this task, we had our robot running in this office for a week. And every 10 minutes, the robot would leave its charging station. It would walk around. It would take pictures. And after 1 week, it would process all of these pictures that it gathered. It would extract certain environmental features from them. And then for each of these features, it would create a temporal model that tells you what is the probability of this feature being visible at a certain time and location. So after some time, when the robot has to operate, it has to retrieve a map that's actually relevant for that particular time. So it takes all of these temporal models, it calculates the probabilities of the features visible at that particular time, and it retrieves the map that's the most relevant for the robot. So this was something that was supposed to be an enabling technology for mobile robots to move in environments which are subject to changes that the humans are actually causing. So this was the robotics idea about this, and this was one of the earliest results. So the core idea is simply to say, okay, probability is a function of time. We use a scheme that's similar to a Fourier transform to create a forecast, basically. So later on, what we did, or we tried, is another application where we actually had our robot running in a hospital. And in this hospital, the robot was supposed to provide some services to the people. And in order to provide a service to a person, you need to find the person. However, it's not socially acceptable for the robot to chase people down the corridors. So what you need to do is to actually anticipate the people presence at certain area. So what the hospital staff gave us is certain significant locations where they wanted the robot to act as a sort of an information terminal. And the robot had to go to these places and offer the information terminal. And whenever someone clicked the interface of the robot considered that it provided some useful information because someone was interacting with its information screen. And it remembered that, okay, at this time of the day and this time, I actually, and this location, I was able to get an interaction. So for the set of these locations, we applied the temporal models that I was talking before. And over 1 month, we have been able to get a few interactions. There are actually not many. And what I'm showing you now is a table of 5 locations. And the attempts for interactions that the robot tried are these tiny dots. I hope these are visible. And either the dot is up, which means that the interaction was obtained, or the dot is down, which means that the interaction was not obtained. And one of the tricky things here is that the robot was not allowed to run during the weekends, and it also was not allowed to run during night. And it still had to infer what is the likelihood of meeting someone at even during the weekend or even during the night. So after our method processed these interactions, we got the probabilities of people interacting with the robots that look approximately like this. So what you can see here is that actually it's quite likely that someone will interact with the robot at a lift, for example, where people are basically bored and they have nothing better to do. And so there is a chance that someone will interact. One of the weird patterns that we got is the cafeteria pattern. And in here, one has to realize that the robot could really observe the environment only during the day. So it could get some interactions during the breakfast time, during the lunch, during the afternoon tea, and then during the dinner. And since this demand for food exhibits some periodical properties, the robot would basically assume that the same pattern continues throughout the night because there was no counter evidence to this. So this was the technology that we did for robotics until this year, basically. And then all this COVID crisis happened, and all our research into social robotics, we could not perform it anymore because yeah, you cannot go between people because you have to practice the social distancing. So we actually started to think how we could be useful, how our research could be useful for the crisis with this coronavirus. So because I had no actually idea about epidemiology or about infectology or medicine or whatever, the first thing that we did, we researched some recommendations that were given by several national bodies and authorities. And what I found out was a bit strange, actually. So to give you a very, very brief and coarse idea what's being recommended, I basically took 3 sources. One is the Introduction to Epidemiology, which is a book that you can download from the web. I took the website of the Center for Disease Control and Prevention, that's a US institution, and I also took the Czech Ministry of Health. And I digged all the words that are in these information sources, and I created a frequency analysis of them. So I basically counted how many times these words appear on these information sources. So in the Introduction to Epidemiology, they were basically saying that the most important stuff to tackle an epidemic is education, contact and prevention, etc., etc. It was very similar for the Center for Disease Control, where they more or less were talking about covering your face and about hygiene, etc., etc. For the Czech Ministry of Health, the first thing was contact tracing. Then they were emphasizing quarantine, and then they were actually emphasizing some smart apps that were supposed to help us, supposed to protect us from the epidemic. So after actually checking these apps, I found out that they are all aimed at contact tracing. And so the idea of this contact tracing is that either you let yourself being tracked, there is of course consent required, and if you become infected, your track is compared to tracks of all of the other people who also are engaged in this in such a system. And then when you found yourself to be infected, a central authority such as the Ministry of Health can quickly find out whom you have met when, and they can start to test these people. So they can quickly gather all the people that you have met, and thus, according to their idea, to prevent the spread of the infection. So one of the main disadvantages of these apps are of course strong privacy concerns. The other problem is that you really need high user adoption, because if there is, let's say, 10% of using that, the chance of actually using such a system to find a contact of yours is less than 1%. And it actually does not protect yourself. It only protects the society. So the motivation to install this is I would say, low. And in general, these systems are not widely adopted. So in my country, there is a system that's run by the version of Google Maps, and there is 10% of people using that, which is definitely not enough to have any meaningful impact. And the main question is that, of course, the government is saying that after the crisis, these systems will be switched off. However, the question is when this crisis will be over, or maybe they will decide that this is an efficient measure also for some other stuff. So maybe there will be problems with switching the system off at all. On the other hand, on the individual level, one can protect himself by proper respiratory hygiene, by social distancing, and by social distancing. One of the problems of the social distancing is that the more you social distance yourself, the less you know about the actual dynamics of the social dynamics of your city and of your surroundings. So you actually cannot actually social distance yourself efficiently. And this is something that we thought we could actually use our models from robotics to help people. So the core idea of us is that we could create, because in the example with the hospital that I showed you, the robot was basically able to forecast where the people are going to be when. And this principle is nicely extendable to larger scales. So what we actually did is that we created a system which consists of a few applications and of certain servers. So what the system does is that it gathers crowdedness data that are provided by the volunteers, and it creates these spatial temporal maps of the public places where you have to go. So it creates a forecast for the next few days of how crowded a particular place will be. So perhaps a shop or a public park, if you want to visit them, you can actually query this system, and it will tell you a forecast for the next day, and this forecast tells you what's the likely risk throughout the day. So this actually allows people who are sensitive to the disease to plan the visits that they need to perform during their daily life. The advantage of this system is that it works locally at low user penetration. You only need a few people to create the spatial temporal map of a certain small city. It also prevents the individual exposure to the infection. So if you want to protect yourself, you simply query this system for the crowdedness of these particular places. And then you decide yourself if you are going to go there at a particular time, or if perhaps you will go there at a time which maybe it's not so convenient for you, but it yields a lower risk of infection. And the main advantage of this system is also that it's not based on tracking people. You are providing information about locations, not about the actual users of the system. So there is no personal data that are processed or that are stored, and the whole system works on modeling the crowdedness of locations. There is nothing that actually processes personal data. So this system there is no reason why we should switch this off later on, because there is no privacy concerns. And so the system can be used even later during the influenza outbreaks. So let me introduce briefly the basic components of the system. So the system actually composes of three things. One is an app where someone who goes outside can simply very easily report a crowdedness at a certain location. So what you do is that you enter approximate number of people in there, you say the density of people is low or high, etc., and you identify also the type of the place where you are. So once you click submit, the system reads the GPS information and the timestamp, and it sends it somewhere to a central server. And what this central server does is that it gathers all these information about these particular locations, and it creates these particular forecasts. So later on, what you can do is that you can identify the places that you want to visit during the upcoming day, and what you can see there is an actual forecast of the crowdedness of the place. So you can actually decide by yourself if you are going there at a particular time or not. And also based on some Monte Carlo technique that prevents the many people coming at the same location and time to a particular place, you actually get a recommendation of the time when to go there. So this system is actually running already. We have it operating in a small town in Czech Republic, and we have some preliminary results. So one of the things that typically people ask me is, well, you can use Google's popular time for the same issue. But one of the problems with Google popular times is that this is based on people who are using smartphones. And this means that you are drawing the data of the busyness and crowdedness of particular locations from actually a small wrong distribution. And as a comparison, I can show you this particular location in this small town in Czechia, where you can see that the Google live data actually claim that the place is not busy at all. Our system actually says that there is a peak, and the reason is that the shop is actually full, but the shop is full of people from a generation that actually does not use smartphones that often, and these are mainly elderly people and pensioners, and they are actually present at the shop, and the shop was actually quite busy. So this is a particular example of where our system, which is based on observations from volunteers, can work a bit better than a big data-based system from Google. Regarding the preliminary results that we have so far achieved on this small study in this town, is that you had this town with 18,000 population. We had less than 5 volunteers to provide the data, and every volunteer provided data from 1 or 2 locations per day. And the volunteers who were using our app were mostly the people who are distributing food to endangered groups, so to people who are chronically ill or to seniors. And we did this test during the April, where this app was actually used by these volunteers. And what we could observe is that during that month there were no new infections in the town, while in the surrounding district the cases increased by more than twice, actually. So what I presented here is a simple system that allows you to aid social distancing by allowing you to plan your visits to public places. This system is actually promotes prevention over restriction. It processes only private data and is based on voluntarity rather than on duty. And what's surprising for us is it's based on methods that are originally from social robotics. And either you can read about these methods at these 2 references that I provide, or you can actually go to these pages and download and try the system for yourself.